Does testosterone cause heart attacks? Is testosterone dangerous when it comes to your heart and your risk of having a heart attack, a stroke, or a clot? Or is it in fact beneficial? I'm Dr. Tracy Gapin, board-certified urologist, men's health expert, and the founder of the Gapin Institute, where we help high-performing men like you achieve peak performance in every area of your life. Now, today we're going to talk about testosterone as it relates to cardiovascular health and answer the question that I get almost daily, and that is, does testosterone cause heart attacks? Does testosterone replacement therapy increase my risk of having a major adverse cardiac event, heart attack, stroke, blood clot, death? There's a lot of confusion around this topic, and so it's worth diving into the literature to understand what's the truth around testosterone as it relates to your heart. So where did all the confusion begin? Well, it began back in 2013 with a very flawed study called the Vegan study. Now, this study was published in JAMA, and what it did was look at men in the VA who underwent coronary angiography who had low testosterone. And what they found, supposedly, was the absolute rate of events was 19.9% in the no-T group compared to 25.7% in the testosterone group, with an absolute risk difference of 5.8%, suggesting that the men who received testosterone had a worse outcome. In fact, however, if you looked at the raw data, and not their analysis, but the raw data itself showed that the men who received testosterone had 2 times lower risk, half the risk, compared to the men who did not receive testosterone. Well, how is it? How could the numbers be so far off? Well, the problem here is it was an incredibly flawed study. They looked at over 50 different variables that they manipulated until they were finally able to come to the conclusion they wanted, and that was that testosterone caused harm. In the testosterone therapy group, 17% of them only got their prescription filled 1 time. So short-term data, what can you really get? What are you hoping to see in such a short time frame? The baseline testosterone level was lower in the TRT group. This is a very important detail because we're going to talk about this in a few minutes. We know that men who have low T have an increased risk of cardiovascular disease. It had nothing to do with the TRT, but in fact, the fact that they had a lower baseline testosterone level to begin with. The mean testosterone levels in the treated group was only 332. Now, we talk about this a lot more in other videos, but that's not even close to where you want to get your levels when you're on testosterone replacement therapy. So I would argue that that's not optimized. 332 is incredibly low still. It's still hypogonadal. And they did not look at free testosterone, which again is the testosterone that we really care about. It's the bioavailable active form of T. They never checked that at all. They also excluded 1,132 men who got a testosterone prescription after they had a heart attack already. Those men should have been included in the no testosterone group. That would have made the results even more powerful that the men without T had worse outcomes. Finally, 104 women were included in this men's testosterone study. Again, greatly flawed study. You really cannot get much information from it to take home. Now, the next study was the Finkel study. This study was published in 2014, and this study was even worse. This was a retrospective review, which is a terrible type of study, based purely on insurance claims. Then they looked at no actual clinical data, laboratory results, nothing. They compared 55,000 men who got a testosterone prescription to 167,000 men who were getting a Viagra prescription for ED. What they found was an increased incidence of heart attack in the testosterone group. The problems with the study were many. Retrospective review, no control group whatsoever. You cannot compare men getting testosterone to men getting Viagra. There was no clinical information gathered, including what were their levels before treatment, after treatment, what was their baseline, nothing. No T levels were ever checked at all in the study. And we know, in fact, that oral PDE5 inhibitors, Viagra and Cialis, are a confounding variable, meaning we know that those drugs may actually help reduce cardiovascular disease. Okay, they cause vasodilation, increased blood flow, and they may actually help in some aspect when it comes to cardiovascular risk. And so not a fair study, not a fair trial. Comparing apples to apples makes absolutely no sense. Nothing to be gleaned from either of these studies because of those flaws. You know, garbage in, garbage out. What we can gather from those studies is really negligible because they were so greatly flawed. But the problem here is that they created this sense of distrust and this confusion and this sudden misconception that testosterone is dangerous when it's not. So let's look at what the literature really tells us. What we know is there are numerous studies that show us the relationship between testosterone levels and cardiovascular health. This study here was a prospective study, great study that looked at 794 men with low T, and it followed them for almost 12 years, long-term study. What they found was men with low testosterone were 40% more likely to die than those with higher levels independent of age. So let me repeat that. Men with lower testosterone in the lowest quartile were 40% more likely to die than those with higher levels. Massive difference. Major study here, prospective trial, to show us that men with low T have higher risk. Another study, this came out of the Molly Shore group, a database review of 858 men from the VA who had testosterone levels documented. And again, they found the same thing. Men with low testosterone level were associated with angiographically documented heart disease and increased overall cardiovascular mortality. They actually did angiograms on these men and followed them for cardiovascular mortality, and they found over an 8-year study massive difference in risk of mortality from the T group compared to the no T group. Low T mortality, the hazard ratio was 1.88. What that means is men with low testosterone had a nearly a 2 times increased risk of cardiovascular mortality in this 8-year trial compared to men who had higher testosterone levels. Massive difference, showing the same thing. Low T is associated with worse outcomes when it comes to your heart. Another study looking at hypogonadism as a risk factor for cardiovascular mortality. A meta-analysis of 70 different studies. Same outcome, same result here. Low testosterone levels are independently associated with angiographically documented heart disease and overall cardiovascular mortality. Unequivocal that men with low testosterone have a dramatically increased risk of cardiovascular disease, cardiovascular events, and cardiovascular mortality compared to men who have higher testosterone levels. Another one here, a meta-analysis of 9 studies with 5 years of follow-up, 255,000 participant years, and they found that men with testosterone levels below 213 had a higher all-cause mortality, and men with levels below 153 had higher cardiovascular mortality. So yet again, same finding over and over, low T equals higher risk as it relates to your heart. Another study out of Mount Sinai. This one looked at men who had received testosterone replacement therapy, and they found they had lower mortality compared to the controls. And again, men with lower testosterone levels baseline had increased mortality. Men with higher testosterone levels had decreased mortality, decreased risk of cardiovascular events. Notably, interestingly, men with higher testosterone levels also had decreased risk of prostate cancer. And I talk about this in a separate video, how we now understand that men with low testosterone likely have an increased risk of clinically significant prostate cancer. Another great study, testosterone in the heart. This study found that lowering testosterone is associated, again, with increased risk of mortality and cardiovascular disease. More than 100 studies have shown reduced cardiovascular risk and mortality with higher testosterone levels, as well as men who receive testosterone replacement therapy. We know that testosterone replacement therapy clearly improves blood sugar regulation. It improves blood glucose levels, hemoglobin A1C, which is a long-term marker of how well you're regulating your blood sugar. It's called insulin sensitivity. And it improves insulin resistance, which is the opposite of insulin sensitivity. Very important point here, randomized controlled trials have shown no adverse change in coagulation factors or thrombotic events, clots basically, with testosterone replacement therapy. Another study here looked at randomized trials, and they found that testosterone improves cardiac ischemia, which means blood flow to the heart, in men with stable angina. Testosterone improves exercise capacity in men who have congestive heart failure. It improves cardiac output. It suppresses and reduces systemic inflammation. It improves muscle strength and lean muscle mass and helps us burn and reduce visceral fat. It improves waist circumference and BMI. It improves body composition. Again, improves glucose regulation and utilization. It improves insulin sensitivity, and it also helps with lipids as well. The key, again, no randomized control trial has shown that testosterone replacement therapy increases major adverse cardiac events. And in fact, men with Mid to higher range testosterone levels have the lowest rate of major adverse cardiac events. It's been shown over and over and over again in dozens of randomized trials, in meta-analyses. Without question, we know that men with low testosterone have increased risk. We also know, however, that any benefit from testosterone therapy as it relates to atherosclerosis likely takes years. And so this really drives home the point that testosterone replacement therapy provides benefit over the long term. It's not a short-term therapy as it relates to cardiovascular health. Another study found that in this observational cohort with extended follow-up, testosterone replacement therapy, again, associated with significant reduction in all-cause mortality, heart attack, and stroke. Another study, androgen therapy in men with testosterone deficiency. TRT, decreased fat mass, increased lean muscle mass, reduced blood pressure, improved blood sugar regulation, meaning improved insulin sensitivity, better lipid profile, meaning LDL, HDL triglycerides. It reduces carotid intima medial thickness. This is basically the thickness in the carotid, which is the artery that goes to your brain. And ultimately, a clot in that artery is what can lead to a stroke. And so this is showing that TRT reduced the carotid intermedial thickness, reducing that risk. Another study found that in older men, this one was a retrospective study of over 6,000 Medicare patients aged 65 and older who were given TRT, and they found that, again, TRT did not increase the risk of a cardiovascular event. Men who are at higher risk, they found that testosterone replacement therapy was actually modestly protective. It showed benefit. Another study from the Molly Shore Group, an observational cohort of 1,000 veterans over the age of 40, followed them for almost 4 years, and again found TRT was associated with a decreased mortality, 10% versus 20%. Yet another study, 11-year follow-up in this study, 428 men were given testosterone undecanoate, that's a type of testosterone injectable, compared to 286 controls. Randomized prospective trial. Body composition and metabolic parameters were measured twice a year. After 11 years, they found that men who received testosterone therapy had lower fasting blood glucose, better hemoglobin A1C, better lipids, better blood pressure, reduced mortality, and major adverse cardiac events. They had improved body composition with lower weight, improved waist circumference, and BMI as well. This is from the Trace Group, a review article, because there was an FDA warning that testosterone therapy increased the risk of venous clots. But this all goes back to those two flawed studies we talked about in the beginning. The vegan study and the Finkel study were grossly flawed. They triggered the black box warning by the FDA, making it bad when it's not. And anecdotal cases, again, can relate to low testosterone levels causing the risk, not necessarily the TRT. And so in this article, he talks about a recent study of 30,000 men, again, had no increased risk of clot. And that most studies done on testosterone show increased cardiovascular mortality with low testosterone levels, whereas men with higher testosterone levels have decreased cardiovascular mortality. He states there's substantial evidence that low testosterone is associated with cardiovascular disease and mortality, and that testosterone replacement therapy will reduce that risk. He also states that testosterone therapy increases lean muscle mass, reduces fat mass, BMI, and waist circumference, improves glycemic control, improves lipids and blood pressure and inflammation. It reduces mortality. We're seeing the same findings over and over and over in dozens of studies, but yet those first two studies get all the attention. These studies all show the same thing: reduced risk when you optimize testosterone. So to summarize, observational studies, clinical trials, meta-analyses, prospective studies have all shown the same thing, and that is there is no increased risk of cardiovascular disease with testosterone replacement therapy. And so what is the effect of testosterone replacement therapy on cardiovascular disease? You have reduced incidence of cardiovascular events, meaning heart attack, stroke, or clot. Reduced incidence of cardiovascular mortality. Decreased systemic inflammation. Improved blood sugar regulation. Improved lipid parameters. Improved body composition. So in summary, when someone asks me, does testosterone replacement therapy cause a heart attack? The literature is very clear. It does not cause a heart attack. It does not cause a stroke. It does not cause a blood clot. In fact, what we know is that men who have low testosterone, especially over the long term, have massively increased risk of a major adverse cardiac event, of cardiovascular mortality, and the data really shows unequivocally that when you optimize those levels, that risk reduces. So I hope you found this video helpful in understanding the relationship between testosterone and cardiovascular health. If you're ready to optimize your health and performance, check out gapininstitute.com/launch for a bunch of peak performance gifts and to learn more about our precision medicine approach to men's health and performance and longevity. Don't forget to hit the like button below. Subscribe to this channel for more evidence-based insights on optimizing your health. Thanks so much for watching. I'll see you in the next video.